This video is not meant to offend anyone. I did research based off of common assumptions made about vaccinated and unvaccinated children. When a mother finds out that she is pregnant with her first child, she begins to do research about her baby, and she also begins to ask her friends who have already had children the questions that she's researched. When should I be able to feel the baby move for the first time? When's the best time to go to the doctor to get ultrasounds? When should I be able to hear a heartbeat for the first time? Is there anything I can do to make sure that my baby comes out perfectly healthy? But the one that will get the mother the most backlash is asking if she should vaccinate her child. Today, I will be talking about myths that you hear commonly about vaccinated and unvaccinated children. I will be proving these myths true or false due to research. I will be providing myths for baby A, vaccinated baby, and baby B, unvaccinated. There will be fewer side effects if I delay my baby's vaccinations. This myth is false. Vaccinations start at birth with the first dose of the Hep B vaccination. These vaccinations rarely have serious side effects. Typically, the worst side effect a child will get is a sore arm or a low-grade fever. The MMR vaccination causes autism. This myth is false. There is no known cause to the autism disorder. To understand autism, you need to understand that there is no test for autism while the baby is still inside the womb. There are tests after birth for autism, but they aren't used until you've seen early signs of autism in your child, such as not responding to their name, waving goodbye, or no smiling by 6 months. I am breastfeeding my baby so they are protected from infections. This is false. While a mother's milk does change and help a baby get well after the baby sends signals to the mother that he is sick, a baby is still able to get an infection. Any baby is able to get an infection. Just because they are vaccinated does not mean they are immune. Vaccinations just help limit the chance of getting the infection. Vaccinations cause the disease they are meant to prevent. This is false. If you look at the polio vaccine, you can see that the vaccination eliminated the disease itself. I haven't seen anybody with chickenpox in my entire life. However, that does not mean the disease is not still around. So many other children are vaccinated that mine don't need to be vaccinated. While it's true that there are a lot of vaccinated children, this does not mean the infection could not get to another child. Using the influenza vaccination as an example, a baby could get the vaccination yearly after they're 6 months. If an unvaccinated child gets the flu and they go around a baby who is younger than 6 months, the influenza virus could get into the baby. Vaccinations don't inject a live infection into my child. This is true. A vaccination is an imitation infection that works with the body's natural defenses to build up immunity to the actual infection. While the research that I have conducted proves vaccinations to be important, we need to realize that it is actually up to the parent as to if they should vaccinate their child or not. Because vaccinations could be more important to one mom than they are to another. Therefore, no matter what me or anybody else has to say about it, it is completely the parent's decision. As long as a child is not at risk, we as a society need to begin to grow and realize that we are not the ones that have the right to judge another person based off of their parenting style.